Welcome back, everyone, to another fabulous episode of Healthcare Trailblazers. I'm excited to be sitting here today with a wonderful friend at this point, Chris Schmaltz. Chris is the Chief ValueBased Care Officer over at Panoramic Health, which is a really cool organization. Excited to hear all about the great work they're doing in the nephrology space. Today, they are serving over 250,000 lives in their company that you guys are actually involved with on a day-to-day basis, which is a really huge number. You've got a network of over 800 nephrologists, just really, really cool, and specifically in value-based care. Thank you so much for taking the time and dropping by today.
Oh, Mendel, thanks for having me. It's an exciting time, and love to have the opportunity to take care of this vulnerable population that we serve here at Panoramic, those suffering from chronic kidney disease. So appreciate you having me here today.
Absolutely. So what's really interesting about you is that you didn't start right in healthcare. You've got a cool background, and you've had some really cool stops along the way. You've worked at some really, really large organizations, Optum, UnitedHealth, Centene Corporation, just some giants in the space. So if you can, let's take a throwback back to where you started before healthcare a couple lifetimes ago, and then how did that lead to healthcare?
Oh, it does feel like a couple lifetimes ago, Mendel. Thanks so much for asking. I actually started I'll call it the first half of my career, maybe a little less than half of my career, on the manufacturing side. So had my undergraduate degree in engineering and spent time both with some small family organizations as well as large organizations in anywhere from aerospace to in industrial gas turbines, special metals, and growing to having the opportunity to lead large-scale operations and run a P&L in manufacturing for the first 10 years of my life, and maybe more than that. I'm dating myself here. And the great part about that, and what I actually am excited when I get the chance to talk about it, is in manufacturing, companies have learned the value of yield and waste, and how long, what's the value of an hour. And instead of measuring things in terms of weeks and months, they measure things in terms of minutes and days. In one of my last positions, when I was with the organization Precision Castparts, I knew in the critical pieces of equipment that I only had 3 down days a year, and they were operating 24/7 other than that. So I knew how to optimize and manage around critical flows. So it wasn't, oh, we're working 9 hours a day, 5 days a week. We were 24/7, 362 with 3 days down for maintenance. So you figure out how to actually run operations on a day-to-day, hour-to-hour, minute-to-minute basis, because if you missed a day, you missed your whole quarter. And so as we think about the principles that can apply to that, and that's actually how I transitioned out of manufacturing into into property and casualty insurance first. We had a CEO who understood that those principles and practices that occur in the manufacturing world could be applied and brought into financial services in a way that would make both better, bring the risk, the analysis, the amazing mission-centric culture that comes with those organizations, and marry it with some of those manufacturing disciplines and capabilities, and bring the best of both worlds together. And so I got to spend the first decade plus of my career on that side, and then have the opportunity to spend a little bit of background along the way. Did a little foray into the insurance space, including a couple years with AIG to help with after the 08-09 downturn. And then transitioned from there over to UnitedHealth Group. After we finished with some of the work at AIG, had the chance to join some prior colleagues that I had worked with in the past at United on the Optum side. And so it was great to actually take those lessons and do something where it really is helping people live healthier lives and making the healthcare system better for everyone, just as UnitedHealth Group would say. So it's been an exciting journey, and the last 12 years has been really focused on healthcare and delivering improved care and capabilities for vulnerable populations that really need our help.
That's great, and I love that because you've had some interesting stops, and I think a lot of people, specifically people that are maybe still starting out in their journey, they don't appreciate time. Time has such an interesting power. And we talk about this sometimes, but, I tell people, focus on yourself as if you're a tool, and the business that you're dealing with today is a material, right? And that material may be here tomorrow. It may not be here tomorrow. You don't know. You don't know where you're going to go in life. But you as a tool, if you can keep yourself sharp, then you should be able to cut through any material. But if the only thing you know how to cut is leather, and then leather disappears, then you're gone. So I love it when people kind of have these chapters. That's love to dig into this a little bit. When you have these chapters and you pick out from it today, when you talk about your experiences there, you talk about fundamentals, you talk about general principles that you learned over a span of time, and you pick that up as a skill, as a competency, and then you implemented that with things that seemingly at first glance are not necessarily connected, but the basic fundamentals, like you kind of started describing, as far as the efficiency and the management part of it, carry over from engineering to healthcare. That's crazy. So what are some of those other fundamentals that you carried over?
Yeah, so I'll start with something that I get a chance to talk to my team about all the time, which is make sure you get the fundamentals, the fundamentals right. They call them fundamentals for a reason. It's that basic blocking and tackling. So do you know what people are doing? Do you know the outcomes that you're driving? Are you measuring them in the right way? Are you looking at the right KPIs? So what really is going to drive outcomes for the business? If I go back to the manufacturing days, what was my biggest opportunity was yield, not how fast something got through a piece of equipment, but how much yield I was getting out of the piece of material that was going in. Same idea that applies in a call center today or a claim shop. It's what's your quality? So starting to think about quality of outcomes and how do you actually think about measurements. If you think about value-based care, it's outcomes that matter to patients, quality, and the cost that it takes to achieve it, efficiency. So how do you marry quality and efficiency to drive overall outcomes? In the case of healthcare, it's better patient outcomes at a lower cost. In the case of manufacturing, it's quality materials at the lowest price that meets your customer specifications. So again, always starts with that customer first, and what's the outcomes that the customer is looking for.
I love that. That's really great. So when it comes to healthcare, that's definitely if you have that happy marriage, then you're doing really well. So what are some insights that possibly you've picked up, some advice to give people on how to balance that? Because you're absolutely right. At the end of the day, you need to run a business, and fortunately or unfortunately, healthcare is becoming more and more and more of a business. But at the end of the day, it is healthcare, and that really should come first. So what does come first? How do you prioritize? What can you give us?
Yeah, so I had a CEO when I was at Centene, and she had a great line that I love, which was no margin, no mission. And so regardless of the mission that you have as an organization, you do have to make sure that you're returning for your shareholders. Otherwise, you're not going to have that opportunity to serve a larger and larger population. So step one, you have to make sure you're running a fundamentally sound business. Regardless of healthcare, regardless of manufacturing, what you're doing, if it's not fundamentally sound and able to sustain, you're not going to be there for the long term. And you see a lot of these organizations that have great ideas, great concepts, but they're not able to turn them into a fundamentally sound business and run it day to day so that it delivers the value, and eventually the investment in that technology can run out. And so I think, as you kind of say, how does it all come together? And I'll talk a little bit about Panoramic here. We look at, we started on you have to be willing to evolve your business. We started as a organization where like-minded nephrologists came together, realizing they could better use data and best practices together to better serve their patient population. The flash forward 10 years, it's 800 nephrologists across 19 states serving over 250,000 CKD patients and 20,000 ESKD patients, and growing from there. But we also recognize that we're evolving today to more of a value-based care world. So while that MSO capability is critical, the ability to put the patient in the middle and say, okay, how do we bring the amazing data that we've got brought together, the physician engagement network, the best practices, the capabilities that are developed over 10 years of nephrologists sharing and learning and best practices, and that patient, and then wrap it around with care services. So how do we then say, okay, now if I can get Chris to engage in these best practices, but because we all know in the case of value-based care, if the patient doesn't activate, you
Yep.
don't get results. If they won't activate, if the specialist for the condition that they're being treated for doesn't encourage them to activate, and the physician's not going to encourage them to activate or get involved if they don't have the right data, underlying fundamentals and data. The best nephrologist in the world, if they're operating independently, only has their own experiences, not the experiences and the data of 10 years of 800 nephrologists with all the best practices brought together. So that ability to learn, build off of each other from data, make sure the nephrologist is engaged, helps the patient activate, and then in the case of a CKD patient that only sees their nephrologist on average 3 times a year, what are you doing between the appointments? How is the care team activating? How are you helping that patient with their other chronic conditions as well as their renal specific diet or their care coordination services or pharmacy or the ability to afford their prescribed drugs? So helping with community service, helping them with smoking cessation. So all those things need to happen for that patient to really live a healthier life, but without them being activated, it's not going to happen. They're not going to activate if their trusted partner, which is the physician, doesn't help encourage them, or at least much lower activation. And the physician can't help drive and be that quarterback without the data, the analytics, the machine learning capabilities and the prompts and the encouragement, because they're busy. So you put all those things around and then underlie it with a team of specialists, of specialized care-specific, condition-specific individuals that really care about and bring it back to the relationship with that patient. Then you deliver outcomes. So you got to kind of put all the pieces together.
And that's what's so great about value-based care, right? I mean, you as the chief officer of value-based care, I'd love to hear what it really means to you, because what I love about it is it makes that perfect alignment, because it changes the conversation to put the patient front and center, and then all the business decisions can then be aligned accordingly, so that you're like you said, you're not, on the one hand, you're not just doing a bunch of free healthcare, and you've got to make your margins, but the business can actually do really well by making the right decisions for the patients. And I find that powerful, but I'd love to hear for you what does value-based care mean?
It's what I love about value-based care as well. And I was looking for something in here, but I'm not seeing it in front of me. Ultimately our CEO, Dr. Podval, says it best, which is do good by doing good. And one of the things I love about value-based care is, Michael Porter and wrote about value-based care in 2006, and it was in a lot of ways a concept at the time about how you can do, how the current system is broken, and you need a system that's based off of competition and innovation that's focused on the condition specific of needs of the patient and measures the outcomes that patients desire and the total cost to achieve them. The reality is, in value-based care today, you can improve patient outcomes and everyone wins, because it reduces the total cost of care. You keep them out of the hospital. You keep them from crashing into dialysis. You slow the disease progression. And by doing all that, costs go down. And as costs go down, it's good for the patient. They're out of the hospital. They're not having additional co-pays. They're living healthier lives. The system you're spending less on the system. You're keeping beds available for individuals that need them in the hospitals, instead of with a patient that's crashed into dialysis that doesn't really need to be there. And as a whole, everyone can share in those reduced cost of care. There's enough to go around versus, did I get my $200 for my treatment? Everyone can share in the total cost of care going down, and the slowing of the disease progression. It really is a phenomenal model. And so one of my favorite questions I get asked on a plane is like, so what do you do for work? And it's like, you say, okay, I'm the Chief Value-Based Care Officer for Panoramic Health. And people look at you, or you can even say CVBCO for Panoramic Health, and people give you a really weird look. And then usually it goes, and so what do you do for work? And ultimately, if you think about value-based care, what I have the opportunity to do is help my teams and others deliver value for patients that they care about at a reduced cost to the system, and then we all share in those outcomes. What an amazing thing to get the opportunity to do.
So, if I can ask you, just for my own education, a couple technical questions, and I'm sure some people have these questions as well when it comes to value-based care. So you mentioned that there's no patient copays. Okay.
Not necessarily. There could be, but they're going to be reduced, right? So if you have less hospitalizations, and again, it depends on the circumstances. In some cases, there is copays, and others it's not. It depends on the value-based arrangement that you're in, whether it be with the payer, whether it be with CMS, in an ACO, in a REACH model. So it really does. There can still be patient copays.
Interesting. And then, so when you are bringing, like you said, the point is to bring down the cost of patient care, and then you basically are able to share in the savings. Isn't there like a line that you'll hit at a certain point where you can't save anymore? Then what? How does that work?
I would love to find that line.
That's the mission.
I would love to be up against that line, and that's the mission. If that mission happens, then I've done my job, and we're outstandingly there. Let me give you an idea, Mendel, of what we're faced with in society today from chronic kidney disease. The World Health Organization in 2020 estimated that there are between 5 and 10 million deaths per year from caused by chronic kidney disease. 1 in 7 adults in the U.S. suffers from some form of chronic kidney disease. That means 1 in 7 people, but over 75% don't know that they're suffering from this progressive disease. And traditionally, 1 in 3 with diabetes will suffer from some form of chronic kidney disease, 1 in 5 with hypertension. And from a health equities perspective, there's a 3 to 4x higher probability that an African American individual will suffer from chronic kidney disease, and yet the transplant timeline is 50%
Why do you think that
longer.
is?
I mean, actually, there's a lot of interesting information, and if you go look at even just some conversations that happened with CMMI last week, historically, as chronic kidney disease was evaluated for African Americans, it was based off of some of the GFR calculations were based off of body mass indexes, and so the subjects that based it all off of were they're created what was actually at the time known as, and I don't know if there's what the term is now, but they actually called it a black factor, which is a coefficient that was applied to when they qualified for CKD services, and yet today we still use that same factor, which slows down when African American individuals are eligible, even though genetically there's more predisposition towards chronic kidney disease. So we have a huge opportunity to bring better health equity, better outcomes to patients, slow disease progression, 5 to 10 million deaths per year. And just to give one other stat, in a Medicare population, the mortality rate is 156 per thousand for individuals suffering from end-stage renal disease. And yet populations that go through transplant, there's a 49 per thousand mortality rate. So it's a 3x difference in mortality rate if we can accelerate transplant, but that means you have to make transplants accessible. And so when we started the question with, is there a line? There is a line. But if you think about a an ESKD population, end-stage renal disease, that costs the system on average $100,000 per year through dialysis and all those. And yet a late-stage CKD patient, CKD 4 or 5, costs the system on average about $44,000 a year. And a CKD 3B patient costs around $2,700 per month,
Wow.
so $30,000 per year. So think about that. If you can slow the disease progression and keep someone at CKD 3B for 2 more years, you're saving $15,000 a year. If you can give them at 4 or 5 for another year or 2, you're saving $50,000 a year for the system. And if you can get them to qualify and be ready for transplant prior to falling into dialysis, you can keep that $50,000 out of the system, reduce additional hospitalizations because of and again, their future mortality rate goes from 150 per thousand to 50 per thousand, to use gorilla math. All goodness. And so, yeah, ideally, you hit a line, but let's make that line much earlier on and slow the disease progression.
So I would imagine this is one of those things that you talked about earlier, how data with a group like you have with 800 providers and 250,000 active patients really helps with a lot of these things. Is there applications for early intervention and early detection so that you can catch it early, manage it better, and all that? What kind of tools or data do you have for that?
Yeah, absolutely, Mendel. And I don't pretend to be one of those nephrologists. Those, if we want to talk about the specifics on GFR, creatinine levels, flow levels, I would love to, let you talk with one of our amazing nephrologists. We do have data analytic tools that are used across 20 different criteria to predict disease progression. So again, part of the advantage for Panoramic is we have over 10 years of history of collecting data on these patients. So we're able to analyze that data, use advanced analytics and machine learning to really understand who are your highest risk patients of crashing into dialysis, of progressing downward, or in having worsening kidney function, and therefore we can customize our care interventions. So our highest risk patients we may be engaging with every week, whereas a lower risk, lower probability of progressing patient, it might be, hey, we're going to do a monthly touch base and we're going to make sure we provide tools for them because they're well managed and well controlled. And so that's part of what we're able to do from an analytics perspective is understand that data, understand the risk of progression, and then customize care plans around the highest severity patient, because you can't, as I'm sure you well know and your listeners well know, you can't be a one-size-fits-all. We have to move more and more towards personalized medicine, and those with the highest risk of hospitalizations, of disease progression, should have more active interventions than those that are well controlled, able to manage their disease, and maybe just need a lighter touch model.
So that actually brings me right into something that we talk about with a lot of guests on the show, and that is the role, the exciting parts, the advantages, the disadvantages of both, we're past the digital, but AI and personal. In your mind, where are we going? And specifically, let's talk, value applications in nephrology. Where are we at? Where are we going with AI? And how does that, where is the happy marriage between AI and a personal touch?
Oh, I think that's a fascinating question. I think it's one that you get Chris's opinion, you get one person's opinion, because I think everyone out there will tell you a little bit differently. One of the things I'll stick with Panoramic for a minute. We have over 70% of our current value-based care patients verbally or in writing opting into their care programs. I know of that's almost 3x the national average for those types of programs. It is because it is AI identified, but driven by personal relationships. So a friend and mentor who's also a best-selling author, Ken Jennings, he wrote The Serving Leader. He'll talk about results happen at the speed of relationships. you have to have a relationship with those patients to be able to get the results.
That's a
And
great line. Sorry.
relationships, you love it's one of my
That's a
favorites.
great
It's
line.
absolutely
That's a
one of my
great
favorites.
line.
And it's the reality. Results happen at the speed of relationships. If you don't have a relationship with that patient, if you're relying on tech, it's not going to drive the same outcomes. Well, all of us have a different relationship with our smartphones than we did 10 years ago. It's still not the same relationship we have with a friend or a family member or our physician or our care team. And so we can, for those that are well managed, rely more on smartphones, technology, AI. But again, it's about understanding each patient and making memorable moments and memorable interactions with those patients. And then, because ultimately, one interaction with the tech that doesn't work, you've lost that patient. One interaction with a human being where they can, but how do you make each moment memorable? Because in value-based care, in any of these, in any program, we have the opportunity and the obligation to engage a patient, make the moments memorable, and therefore the patient's more likely to engage in their own care. If in the case of CKD, and I share this with my team a lot, you have individuals that are scared. It's a progressive disease that takes 5 to 10 million lives a year.
Yeah.
And the idea of dialysis scares anybody, fistula placement. And so in the case of fear, there's 3 human reactions. There's fight, there's flight, or there's freeze. And our job is to help people move from freeze or flight into fight. Tech doesn't do that. It doesn't engage people to do the change management, to take that ownership. And my phone can do lots of things, but it can't do it for me. Yeah. It can say, "Hey, Chris, you should get my Aura Ring and my phone can say, Chris, go get up and walk around." But if I don't, I'm not living a healthier life, and the scale's going to show it. Unfortunately, true. But so we have to engage the patients, because only the patients can only the patient go to the appointment. Only the patient can take their medication. Only the patient can invite someone into their home from their care team. The tech isn't going to do that for them. And yes, wearables and all those things will help us better understand patients and what they're doing, but ultimately, healthcare is personal. And so let's keep it personal.
Yeah, wow. That was a really great breakdown, and I couldn't agree with you more. Absolutely. It's so helpful when it comes to detection and, like you said, data patterns and stuff like that. Like, great. And it's a great help. And you can't be, if you're all person today, then you're not efficient. Like you said, it's got to be really a balance. But the implementation, the partnership, the empowerment, that I couldn't agree with you more. That has to be human, and we see it every day. We see it here. Absolutely.
Yeah, it's artificially intelligent enabled, right? It's tech enabled. It's not. It's not about my phone doing it for me, right?
Yeah, I couldn't agree with you more. Well, Panoramics is clearly doing. You guys are at a really great stage. Talk to me a little bit about what are some very specific services that you offer your nephrologists today. How could somebody join in with Panoramic? And then I'd love to hear where you're going, because you're very passionate about it, and you're clearly doing great work.
I was going to say, does that come through? I'm not quite sure. Yes, I do love what I do. Just a bit. I really love what I have the opportunity to do. I'm not clinically trained in any way, and so the ability to help impact vulnerable populations' lives. You heard me talk about, I started in manufacturing, so the ability to actually do things that are doing good by doing good is phenomenal. Panoramic, again, so if you think about Panoramic, there's really 2 arms to Panoramic. We have our MSO offering and our practice operations. So those 800 nephrologists that's growing rapidly. If you were to look just about a year ago, that was under 400.
Wow.
So growing very rapidly on those integrated nephrologists. We provide the nephrologists anywhere from the data analytics and insights all the way through full MSO offerings, which include billing, revenue cycle, practice management. The physicians and the clinical teams maintain their independence, but will offer full MSO services and actually do the practice management for those individuals. And again, all based off of the analytics, the best practices, and the workflows that we've developed over the years. As I mentioned, the other arm of Panoramic that's really evolved over the last several years and really accelerated here in 2022 is our value-based care arm, which is where we engage and provide the wraparound care services to patients in a value-based arrangement that are engaging both with our nephrologists, but also other nephrologists that maybe it may not be one of our nephrologist patients, but we can engage that nephrologist with patient-specific scorecards, back to that personalization of the patient, and engage them in such a way that ultimately we're providing the wraparound services for the patients. And what those services could include care coordination, hospital coordination, renal dietitians, pharmacist support, behavioral health support. So really understanding total person care and how do you put all that services around so that we can activate that patient between the appointments. So if you think about that CKD 3B or CKD 4 or 5 patient that's seeing a nephrologist somewhere between 1 and 3 times a year, it's all those services that activate the patient in between the appointments, help them live the healthier lives, and keep them out of the hospitals, and doing what they should be doing while slowing the disease progression. Again, if we can get them on the right food, the right medication, the right food. Great story that we heard from one of our patients the other day, and for confidentiality, I'll call him Pete.
Yeah.
Pete is one of our existing late-stage CKD patients, and through our pharmacy feeds and our EMR feeds from our nephrologist, one of our care team identified that Pete was not picking up all of his medications. So our care team member reached out to Pete, started talking to him. Pete, notice you're not picking up all your prescribed medications. What's going on? And over a little bit of time, Pete shared that, I can't actually afford all my medications, so I only pick up the important ones, and I take the important ones. And I'm thinking, okay, this is Pete deciding which are the important medications that he's going to take, and I do wonder how many of those important medications are based off of how much they cost him.
Yeah.
And so our care team then was able to engage with 4 different community service organizations to not only ensure that Pete's getting his prescribed medications and able to get them, but also to engage with food insecurity so that he can actually get the food for his renal-specific diet.
Wow.
Now, if you think about that, Pete is no longer self-medicating. Pete is able to have the right food for his renal-specific diet. What are the odds that we kept Pete out of the hospital? And think about that. We helped with community services to get him his right prescriptions. We helped with food services, and we're going to probably save at least 1 hospitalization over the next year because he's no longer self-medicating and deciding what are the important medications. Average hospitalization, $15,000. How much did it really cost for us to help him? And so when you start thinking about the return on doing good by doing good, everyone wins. We've kept a bed empty for someone that needs it. We've kept Pete at home. Pete's now living a healthier life.
Yeah.
Everyone
It
wins.
works.
It's amazing. So those are some of the things that are happening at Panoramic today. You're right. I am I love what I get to do. It's amazing, and I get to lead an amazing team. The culture, the people, the caring, the compassion, the way that they think about every patient. I mentioned the results happen at the speed of relationships. For us at Panoramic, every patient relationship is personal, so we keep driving for those results, and it's amazing to see what happens.
That's awesome. Wow, what a mission! It's so nice when we just had a 40-minute or so conversation, and just the mission cuts right through the entire thing. I think it's very clearly driving you, and it's really something special to see. And any industry, but specifically in healthcare, that's a very powerful thing. So, Panoramic is definitely going in really cool places, and I'm excited to see as you guys continue to evolve. And I wish you the absolute best. Thank you so much for joining today.
Oh, it's absolutely my pleasure. Thanks for taking time to spend with me. I mean, again, it comes out. I love what I get to do for a vulnerable population, and I can talk about it all day because it's just meaningful. And if one person is able to partake, one nephrologist, one patient, one payer, because of this conversation, and it keeps one person out of the hospital, we've done our job for the day.
Absolutely. Couldn't have said it better. Chris, thank you so much.
Mendel, thank you. You have a great day.